The federal government has announced its intention to grant waivers to federal hospitals nationwide, allowing them to recruit additional staff. And I'm joined by Minister of State for Health, Tunji Alausa, who joins us live from Ibadan. Thank you for staying the course on the program. Interestingly, Honorable Minister, just this morning, workers of the Obafemi Awolowo Teaching Hospital staged a protest over unpaid salaries, which they say has lasted for almost a year, and the sack of others. So on one hand, government is giving federal hospitals waivers to recruit more. On the other, some workers aren't getting paid, and some of them are even being laid off. How do these really add up?
Thank you so much, and I need to do some clarification here. Sorry to hear that workers in Obafemi Awolowo University Teaching Hospital are saying are staying a worker because they've not been paid for. Let's get to the facts of the matter. The problem that I just told you about, that there was no secondary check, there was no reverse check on the waiver approval that they were previously given, was what caused this problem. Obafemi Awolowo Teaching Hospital is killing. The last waiver that was granted to them gave them waiver to recruit just about 450 new employees in the hospital. But that was grossly abused, and almost 2,000 people were recruited. And those, I can bet you, the people that are not paid are the people that are wrongly recruited. There was no budget backing for those people. But we've since done our own investigation, and all the people that are involved in that patriotic and wrongful behavior would really be dealt with based on the rules of the government. So that was a specific situation that happened in that case. But now the new processes that we now have for waiver, where we would check the request from hospitals, and then we will do a second check. And once those employees have been recruited, to be sure that the people recruited were actually what the waiver was about.
I hear you, Honorable Minister, and I understand what you say government is planning to do differently. Sometime last year, we heard about the indictment of some officials, of the teaching hospital that you made reference to, including the former acting chief medical director, for allegedly engaging in job racketeering. But the question is, what happens to these other people? Those who were involved in job racketeering have been indicted. Are you saying there's no hope for these well over 1,000 workers who have been affected in Ife?
No. A new verification and interview will be conducted. Everybody will be recruited based on civil service law, and the ones that were wrongly deceived and they were gouged by collecting money from them to get a job, we will make decision on what we need to do. But we have to follow civil service law. We're law obeying, we're citizens, we're law and order reigns. So we will not right from wrong. We will follow due process and diligent process in getting to the bottom of this matter.
So the issue in Ife is that there were more staff employed beyond, the waiver of 450 vacancies. I'm just curious to know if it is clearly stated the number of people they can employ this time, and what is the ministry doing to, really prevent the abuse of these waivers this time?
Going forward, I can bet you there will not be abuse going forward. But let me tell you, even currently, when waivers are granted, those waivers are job specific. The hospital, for example, might say, I need 20 doctors, 20 consultants, 10 registrars, 50 nurses, 10 engineers. Once the verification has been done by the head of service, they will look at the budgeted budgeted establishment role. Those waivers will be granted 20 doctors, 50 nurses, 10 engineers. But then, by the time those approvals get to the hospital, it gets changed. They will not recruit the exact waivers that were granted to them. they will engage in recruiting things, what they just feel they want. They might not end up recruiting 500 administrative staff. Not that we don't need administrative staff in a hospital, but we have to staff a hospital with the nurses that we need, with the dietitians that we need, with the doctors that we need, and with pharmacists that we need, and the other support team that we need.
You know, part of the resolutions made by FEC last month is also an attempt to relieve the escalating cost of pharmaceuticals, following the exit of major multinationals leaving the country. Help us understand what the plan is in this regard. Are we looking forward to a subsidy for drugs?
I won't say subsidy. We have a free market-driven economy. But then you saw the passion of the president at that FEC meeting, even before his commitment to making healthcare easily and affordable to the citizens of Nigeria. What we're going to do, what the president has decided to do, will be to issue a set of executive orders that we're working on between the two Ministry of Health and the Attorney General Service, as well as the Ministry of Trade and Investment. So what we're going to be doing, we'll look at what kind of succor relief we can grant to pharmaceutical manufacturing companies in terms of waiver for custom. And let me actually I don't want to second guess the president here. We're putting several interventions together for him to review and come up with an executive order. As you know, executive orders are law. So the president is determined to bring the prices of pharmaceuticals and medical consumables down very quickly in the not too distant future. So we're working so hard to get to this component to the president to start working on the executive order. But Nigeria should expect succor very, very soon.
We're looking forward to that, and we're counting on it as well. But I don't know if you've heard some pharmaceutical industry players who have also specifically asked the federal government to create what they call a 600 billion naira pharmaceutical manufacturing development fund at 5% interest over a minimum tenure of 7 to 10 years to support local production. Is that something government will be considering?
Of course, everything is on the table. Anything that will bring succor, good life to Nigeria, the president is open to it. And we are working for the president, we're working for Nigeria. Anything that's reasonable, that will not lead to abuse, we're reviewing everything. President and everyone, we're open to that. But let me emphasize again, there are lots of options that we're reviewing now, but we're going to come up with what will benefit the country, what will not be prone to abuses. We have to do this very well and get it right.
You sound quite optimistic. I'm wondering where really the hope this year is coming from, particularly for the health sector, because just like previous administrations, this government didn't honor Nigeria's commitment to the AU to allocate at least 15% of the country's annual budget to the health sector. The 2024 budget allocated just a little over 5% this year. Are you concerned about funding?
No, of course. No money can be enough. But these governments, compared to previous governments, have shown the most commitment to funding the healthcare sector. This is the biggest budget in the last 10-15 years that the president has approved to the healthcare sector. We're not at that 15% margin, but I'm not sure where you got your number of about 5.1%. I think we're far up, we're higher than that. But from where we started from, it will be increased trajectory going into the future. And then now beyond that, there's still going to be supplementary budget. The government the president can come with a service-wide vote to support us. This is the president that cares. President Bola Ahmed Tinubu cares for Nigeria, cares for every sector in Nigeria. But more importantly, he said it himself, healthcare is on the front burner. This government would move into the future to meet its commitment of committing 15% of the budget of budgetary allocation to health. But this is the first budget we're having as a government. But this first year budget increased significantly the amount of allocation to the healthcare sector. We should give the president a lot of commendation here, is meeting his words, is meeting with words with action. So we as the Ministry of Health are very thankful to him, and we're going to ensure that this increased budgetary allocation is well spent in the right sector that needs the right sector of healthcare that needs this money the most.
Where are we with revamping the national health insurance program in such a way that we can cover more people when they need such services?
That's a good question. We're working hard today. Honorable Mr. Pate, Coordinator Mr. Pate, Professor Pate just met today in Lagos with all the HMOs, with Nigeria Health Insurance Administration and the Health Insurance Agency and all the state insurance agencies. If you've seen in the news not too long ago, we put a SWAP program together, a sector where we're now mobilizing more funds from our development partner so that we can reduce the fragmentation in healthcare, begin to align our funding more. Some of this fund, a significant amount of this fund that we now realign will go into our health insurance so that more people can be covered. And as part of our plan to get this process rolling, was one of the things. The first step was the big meeting that the Coordinating Minister for Health, Professor Pate, had with the HMOs today in Lagos, HMO, the National Health Insurance Agency, and the State Health Insurance Agency.
When the president said that we should not worry about jackpot, that more people will be trained, it was very controversial for many people who reacted to that statement in quite different ways. But what would you say to your colleagues? Because the brain drain in the health sector is, is quite much compared to others. What would you say to them now in 2024 for those who are still, very curious about living?
Absolutely right on this. And he said it right. He knows what is good to do for the country. This president is determined to change the course of this country for better, sustainable into the future. So when he said, don't worry, we will produce more. We have a population of 220 million people. We are leveraging that population to aggressively increase production. So obviously, it's a free world. Some people will go, but a lot will stay. But as we move quickly to improve our infrastructure in our healthcare delivery system, we work to bring in modern equipment to our hospitals. We're working to aggressively, in an expansive manner, improve the working conditions in our healthcare sector. And the president is also working to increase, to improve the welfare of what our healthcare workers will get. So what do you expect? Nigeria will now be a destination where people come to work. And we're also increasing production. So the president, in his infinite wisdom, knows what he's talking about.
I hear you clearly. We have to go now. But with the waivers granted the federal hospitals, between now and when can these people actually, I'm talking about the recruitment process really now. From when can we begin to see this new faces? I mean, this new pumping of, the pumping of new manpower into our federal hospitals?
Yeah, we were the one that, at the Ministry of Health, we requested the president to grant us this authority, this power, to start for the waiver to be domiciled at the Ministry of Health. We will not delay it. We will work on it expeditiously and get the process moving expeditiously. It's actually started now. Any new waiver requests for human resource for health at the hospital are coming out to the Ministry of Health, where we will review them and then quickly work on approving what the hospital actually need and what they've been budgeted for. So the process has actually started.
It did. Minister of State for Health, Dr. Tunde Alausa, thank you so much for talking to us on the program this evening.
Thank you so much.
And that's our program, everyone. You can watch it again at midnight and at 6 a.m. I am Nifemi Oguntoye.
Following is a paid presentation by ShopX TV.